The 8 different types of arthritis causing you joint pain. Arthritis and pain in your joints. The word arthritis originates from arthro, which translates to joint, and itis, which translates to inflammation. Amazingly, this term is used to comprise over 100 different, yet related conditions. Do you suffer with, or have you ever suffered with, any type of joint pain? In this first video in the series of the Secrets of Arthritis, you'll discover what arthritis, in its basic form, means, and the 8 different types of arthritis causing you joint pain. Before then, don't forget to subscribe to our channel if you're enjoying the other videos in this series, and then please click the grey bell icon to be notified of future videos being uploaded to the Natural Health Guys channel. So, in terms of the pain in your joints, what does arthritis mean to you? A pain in your joints can be a pain in the. Here are 9 key points to bear in mind when dealing with arthritic issues. 1. The common thread connecting the above-mentioned diseases is musculoskeletal pain and joint pain. This is why these varied conditions are grouped together under the common umbrella called arthritis. 2. Inflammation is often the body's natural response to injury, and inflammation of the lining within the joints is common. 3. These joint issues can range from relatively mild cases of bursitis or tendinitis to much more severe and crippling forms of inflammation, such as rheumatoid arthritis and osteoarthritis. 4. Conditions known as pain syndromes, such as fibromyalgia, as well as systemic lupus erythematosus, which involves every portion of the body, are also related. 5. Other representations of the disease, such as gout, are additionally related, however, they are rarely connected. 6. Additional symptoms include pain, the affected joint being hot to the touch, swelling and redness. 7. Once the joint is inflamed, it may develop all or some of these symptoms. 8. Obviously, this can become excruciating and the normal movement of the joint can become extremely limited. 9. Everyday activities may become difficult and loss of motion can occur. The 8 different types of arthritis. Unfortunately, arthritis can affect anyone, although some specific types affect certain demographics more than others. There are also several types of arthritis that may affect people of any age, race or gender. The good news is that there are steps that can be taken to help your body facilitate healing, and help to eliminate or reduce the inflammatory response that's responsible for the condition. Children and babies as well as young adults can suffer from this condition, with approximately 3 people out of 5 who have arthritis being under 65 years of age. Number 1. Rheumatoid arthritis. Rheumatoid arthritis is the type of arthritis that can cause the bones to appear disfigured or deformed. It's an insidious disease whereby the body's own immune system attacks the joints and surrounding tissues, and in some cases cause problems in other parts of the body. It causes painful swelling, in which case anti-inflammatory medications are prescribed. Unfortunately, such medications are prescribed to suppress the symptoms, whilst creating, in some cases, additional problematic side effects. They don't deal with the root cause of the inflammation problem at a cellular health level. Number 2. Juvenile rheumatoid arthritis. This condition is also called idiopathic arthritis. This type of arthritis affects children and adolescents below the age of 16. Reddish, swollen joints accompanied by pain are some of the most common symptoms. Some children and adolescents experience its symptoms for just a few months, whilst others suffer for the rest of their lives. Treatment is mostly focused on keeping the pain under control, preventing the occurrence of any complications and in improving the mobility and joint functions. Number 3. Osteoarthritis. Often associated with the ongoing wear and aging of your joints, this type of arthritis is characterized by stiffness and joint pain due to cartilage erosion within a joint. It commonly affects the hips, hands, spine and knees in menopausal women and the elderly. Number 4. Psoriatic arthritis. Fingers and toes are most susceptible to this kind of joint erosion arthritis that affects patients with psoriasis. Fingernails may become deeply ridged and pitted in affected individuals. Number 5. Gout or gouty arthritis. This acute form of arthritis results from a disturbance of protein metabolism in the body. Its symptoms include: 1. Uric acid production is increased and deposits of uric acid crystals can accumulate within the joints. 2. The toes, fingers and knees are most commonly affected. 3. Normally, excess crystals are eliminated via the urine. However, they can build up and cause crystal formation if any issues arise with the elimination process. 4. If left untreated, the arterial system can become affected. 5. An individual with this type of arthritis will experience sudden attacks of joint pain accompanied by redness and swelling in the affected area. 6. In most cases, the joint on one of your big toes is often the first joint to be affected, while your knees can also experience pain. 7. Men are 10 times more likely to suffer from this condition than women. 8. People who are obese, overweight, alcoholic, or drink in excess face a higher risk of having gouty arthritis. Number 6. Pseudo-gout arthritis. This type of arthritis commonly affects the wrists and the knees. However, it may also affect the ankles, finger joints, shoulders, hips, and elbows. Pseudo-gout arthritis occurs when the calcium pyrophosphate crystals, CPP, accumulate in the cartilage of your joints. The formation of CPP can be caused by having abnormal cells in the cartilage. It can also be caused by injury and/or surgery. In some cases, pseudo-gout arthritis can also be hereditary. Number 7. Infectious arthritis. This form of arthritis results from an infection caused by bacteria, fungi, or a virus that gets into the bloodstream affecting the joints. It can also occur as a result of an infection in an area near the joint. Infectious arthritis can either be acute or chronic, as follows. 1. Chronic infectious arthritis is caused by fungi or mycobacterium that also causes tuberculosis. This type of infectious arthritis develops gradually over a period of several weeks. 2. Acute infectious arthritis can be caused by viruses and bacteria. This type of arthritis can develop quickly, and the cartilage or joint affected can be damaged within a few hours or days. Number 8. Hemorrhagic arthritis. This type of arthritis results from the blood getting into the person's joints, leading to inflammation, and may occur as a result of trauma, injury, lesion, or cut to the joint. People who have hemophilia A, hemophilia B, and sickle cell disease face a higher risk of hemorrhagic arthritis. Therapy for this kind of arthritis will usually depend on its cause. Summing up, as you've now seen, there are many types of arthritis, and not all are easy to self-diagnose. If you feel any pain in the joints, especially if the pain and any stiffness is not receding or is getting worse, you must seek advice from your healthcare professional. The Secrets of Arthritis video series is continued in the next video, which looks in more detail at rheumatoid arthritis and how best to deal with it. We hope you found this video, the 8 different types of arthritis, helpful and of interest, and please feel free to share with people you think will also find this video worth watching. To get more videos like this one, why not become an exclusive subscriber of this channel? By clicking on the subscribe button in the bottom right corner of this video, and then click the grey bell icon to ensure you get notified of when the next video is uploaded. Many thanks. And here's to the start of a journey to help you and anyone else you know to manage any of the conditions mentioned above in a way to improve your overall lifestyle.